having us. I'm presenting the NBME Clinical Subject exam or shelf exam performance as an indicator for USMLE Step 2 performance alongside Ms. Mona Blankenship. The objective of this study was to demonstrate that shelf exam performance is related to Step 2 performance. We have no conflicts of interest. The NBME Clinical Science Shelf exams are 165-minute exams that consist of 90 to 110 questions based on the information learned during a student's core clerkship. The core clerkship included in this study consists of internal medicine, family medicine, pediatrics, obstetrics and gynecology, psychiatry, and surgery. The NBME shelf exams allow medical institutions to access overall and specific content area scores of their students. The USMLE Step 2 is a one-day examination that is divided into 8 60-minute blocks administered over a 9-hour period. The exam is meant to test the knowledge of third-year medical students on the topic of the previously mentioned core clerkships. Both of these exams are designed to evaluate the medical knowledge of third-year students, as well as their ability to practically apply that knowledge. On the 2021 National Resident Matching Program PD survey, the USMLE Step 1 exam was previously ranked the #1 most important factor for residencies in determining which applicants received an interview and who to rank. When Step 1 transitioned to pass-fail in 2022, residency boards needed reliable metrics to objectively measure the qualifications of their applicants. Therefore, a higher priority was placed on Step 2 scoring as a numerical objective assessment of the clinical knowledge of its applicants. Our study aims to provide data-driven insight into how performance on NBME clinical subject exams correlates with Step 2 scores. The goal is not just to simply predict how students will perform on Step 2, but we also want to help institutions prepare their students for Step 2 and encourage students to prepare well for the NBME clinical subject exams. Our study design is a retrospective analysis of shelf exam scores and Step 2 scores from a single institution between the years 2020 and 2023. We matched every student's Step 2 performance with all 6 of their NBME shelf exams. The study was approved by the International Review Board and is double-blinded, meaning that data is de-identified. A chi-squared analysis was used to identify the relationship between individual clinical subject exam performance and Step 2 performance. Regression analysis was used to determine what is predictive of failure for Step 2.
At our institution, out of the 277 students who took Step 2 for the first time between 2020 and 2023, 219 passed on the first attempt. This is a 79.1% first-time pass rate. We can see that the data shows significant relationships between Step 2 failure and each of the following: failure of any shelf exam in general, failure of the internal medicine exam, failure of the OBGYN exam, failure of the pediatrics exam, failure of the surgery exam, failure of 2 or more shelf exams, and failure of 2 or more shelf exams multiple times. We did not find a significant relationship between Step 2 failure and failure of the family medicine exam, failure of the psychiatry exam, failure of 1 individual shelf exam, and failure of 1 individual exam multiple times. The relative risk for our data is 2.2. This means that there's a 220% increased risk in the chance of failing Step 2 if the student has a shelf exam failure. While our study at this time was simply driven by pass-fail metrics, the aim is to demonstrate to students the importance of taking each of these shelf exams seriously because it could impact you in the long run. We also want this to encourage school leadership to intervene and check in with students after even just 1 shelf failure. Showing that shelf scores have a predictive value for Step 2 can also provide programs who choose to look at shelf exam scores a more holistic view of the applicant. Rather than just looking at a single performance on a very high stress day, they can look at a student's performance over the course of an entire year. The results of this study is not to discourage students if they have a failure, but to encourage them to not shrug off this failure and to evaluate, make changes in their study strategies ahead of time instead of waiting until after the Step 2 failure. A major strength of this study is that it's one of the first of its kind to evaluate this relationship between shelf performance and Step 2 performance. Additionally, our institution is unique in that we have a wide range of student performances, and so we were able to collect this data relatively quickly. Weaknesses of the study include that a portion of this data was collected during the COVID-19 pandemic, which did did decrease students' clinical exposure, as well as our institutional problem-based learning curriculum had not been implemented at that time. An additional important weakness is that this is from a single institution, which leads us into possibilities for future research. We would love to see other institutions evaluate their own data on shelf scores versus step 2 performance, so they can seek out their own strengths and weaknesses and share them with others. As well, we see that there would be value in expanding upon this project to analyze percentile performances on shelf exams in correlation to percentile performances on step 2, as well as accounting for different variables such as study strategies, even socioeconomic factors, and language proficiency. I think could be good things to add to the study in the future. But with that, thank you so much. Here are our references.